Absolutely. Again, getting back to making the patient feel comfortable. So I do have a large population of patients personally that comes from minority populations. Some of them speak Spanish. So again, making sure that there's a translator there or family member who can relay what I'm saying to the patient. Translation services are very important because again, the patient may be hearing one thing when you're trying to explain the significance of treatment and diagnosis. And again, just being aggressive with therapy. I think many patients don't understand the significance of getting started on therapy right away. So that way they're they're not being, targeted severely with their disease. And also giving them the hope that there is remission with some patients when they are treated early. So again, translation services. I'm a big proponent of, again, patient power empowerment. So if a patient does not speak English, it's important to maybe get information, whether it's on the web. Again, the American College of Rheumatology again has patient education material in Spanish. You can look for other materials in other languages. So that's really important as well. And, again, also asking patients to maybe come back for another visit. So it's very overwhelming to really discuss all these therapeutic options in one visit. And it's, these patients get overwhelmed and they may not want to come back or start therapy. So I always give them another option to come back, to sit down and just talk about and just ask questions. And I do feel that's been very helpful when they come back and they have their questions ready. So again, recognizing that their cultural beliefs may also impact their decision-making. Again, there are patients who are Jehovah's Witnesses, or other patients don't want to take biologics because of, maybe beliefs about fertility or other things. So again, you have to really be cognizant, checking your implicit bias at the door, and be cognizant of the patient's cultural beliefs, as well as, their hesitancy because, again, mistrust. But I do feel like it does help, and also getting other people in the office to help when there are patient populations that may, again, recognize themselves in other healthcare practitioners.